This is Chapter 19's second video looking at hemostasis. If you haven't listened to the first video on Chapter 19, I would highly recommend that you start with that one. So we're going to talk about hemostasis. We're going to discuss the mechanisms that controls blood loss after an injury, including blood clotting. And then we're also going to explain the mechanisms of action and give some examples of anticoagulants and fibrolytic drugs. Briefly, we won't spend a lot of time on those. All right, so we're going to look at hemostasis. Please do not confuse hemostasis and homeostasis. Hemo refers to blood, stasis means stay. So this is the act of being able to keep your blood within your cardiovascular system. So it's blood clotting, basically. When we look at hemostasis, there are three stages, and we're going to start with the first one, and this is the vascular spasm phase, or the vascular phase. And so if you take a look, you'll see that there is a blood vessel, and the blood vessel has been cut in half. So we have a blade, it cut the blood vessel in half. The first thing that's going to happen when injuries occurred to those endothelial cells, it will cause the endothelial cells and the smooth muscle cells around them to contract. And just simply by making this hole smaller, we know that we are going to slow down blood flow, because this is going to increase resistance, which means it's going to make it more difficult for blood to flow through here. These endothelial cells also are going to release hormones, and that's going to cause platelet factors. It's going to attract the platelets to the site of this injury. Along with that, the endothelial plasma membranes, so when we take a look at the cell membranes of these endothelial cells, they become sticky, which means that as the platelets float by, so endothelial cells release platelet factor, as the platelets float by, because they've been attracted by this platelet factor, they're going to stick to this, to the damaged plasma membranes or cell membranes. They've become sticky. And that moves us from the vascular phase, which happens very quickly but doesn't last forever, into the platelet phase. Now, just to make sure that you understand this particular illustration, this bottom row that you see here, this is looking at the edge of the membrane. So this would be interstitial fluid out here. This would be the lumen of the blood vessel, and the other wall of the blood vessel would be out here. So we're only looking at one side now. So again, we had damage to the wall of the blood vessel, and we secreted, when we had this damage, it caused the secretions of platelet factors, which caused the platelets to be attracted to this area. And then these endothelial cells became sticky, and they've caused these platelets to begin to stick here, and eventually they're going to form a platelet aggregation, because we're collecting more of them, and if depending how thick this wall is and how much blood pressure we have running through here, a platelet plug may form. Now, this is not a blood clot. This will not withstand, once the vascular spasm relaxes, this will not withstand the pressure of regular blood flow through here. But it is a step in the right direction, and we are starting to close off and not allow blood loss to happen through this hole anymore. Okay? And so that moves us on to the next phase of this, which is the coagulation phase. And I know this looks a little overwhelming, but bear with me, we'll talk our way through this one. The coagulation phase is when we're actually going to form a blood clot. So we're going to get something that looks like this, that you see over here on the electron microscope image. It is when you have a scab on your knee, that is an external coagulation or blood clot. It can happen both internally and externally. So when we have this blood clot forming, one of the things that we need to consider is that we have clotting factors. Clotting factors are responsible for the formation of blood clots. You have a table, 19.4, that lists all the different clotting factors. I don't expect you to know them all. I want you to know some basic facts about them. Clotting factors always include calcium. So if calcium isn't present, you can't form a blood clot. There are also 11 proteins, and most of these are proenzymes. And this proenzyme means that they aren't active yet. So they're getting ready to function, but they have not yet started to function. So they are proenzymes. All but 3 of these clotting factors are always found in your blood. So your blood is always prepared for an emergency. If a damage occurs and blood loss starts to happen, you have these clotting factors available that can start very rapidly blocking off wherever this hole is and allowing for this blood clot to form. Most of these clotting factors are produced by the liver, and once the coagulation phase is initiated, it causes a cascade of activity that can't be stopped. So once we get it started, it's going to follow its way all the way through here and keep working. It will not stop along the way. All right, so when we take a look at this, one of the things I want you to realize is, so here we have the start of this platelet plug. We have the damage to the blood vessel wall. Remember, all of this can't happen if the blood is flowing through here too quickly. And so that's why when you have a major injury, one of the first things that you've been taught to do in your first aid classes is to put pressure on this wound. And the reason why is because that slows the blood flow down and allows the opportunity for the platelet aggregation to occur, the platelet plug to occur, and eventually for this coagulation to happen. When we look at the process of creating a blood clot, there are 2 pathways to forming this blood clot. We have an extrinsic pathway and we have an intrinsic pathway. We're going to start by looking at the extrinsic pathway. The extrinsic pathway is initiated due to tissue damage to the blood vessel. So this is extrinsic, meaning it's happening outside of the blood. With this tissue damage that occurs, this will release, the endothelial cells here will release tissue factor, which is clotting factor 3. Tissue factor and clotting factor 3 are going to, this clotting factor 3 are going to connect with calcium ions, and also clotting factor 6, and that's 7, can't read Roman numerals today, that's going to create this tissue factor complex. You don't need to know any of these numbers. All I want you to know with extrinsic pathway is that it started by the tissue damage starts by releasing a clotting factor. It has to have calcium to join up with it, and that causes a tissue factor complex that will activate factor 10. Okay, this tissue factor complex activates factor 10. The intrinsic pathway takes a little longer to get activated, so this one happens right away. Tissue damage, and immediately we're going up this pathway. On the intrinsic pathway, it takes a little longer because now the vascular spasm happens. I have to have platelet factor being released, and then this platelet factor actually becomes connected. And again, you can see I've got calcium ions here. What happens eventually is this all comes together on the intrinsic pathway, and it's again going to generate the activity of factor 10. Intrinsic pathway is slower, but once it's started, it is a greater reaction. You have more activity happening. Both the extrinsic and the intrinsic pathway are going to end up with factor 10 activation, and that's the beginning of the common pathway. So the common pathway is going to lead us to a blood clot formation. So factor 10, when it's activated, becomes prothrombin activator. In your bloodstream, you have the clotting factor prothrombin. It's a proenzyme, so you see that word pro in front of it. It means that right now it's not activated. This prothrombin activator is an enzyme that's going to convert prothrombin into thrombin. This is important. Thrombin now is an enzyme. It's an active enzyme, and it's going to look at the fibrinogen that's in your blood. Again, fibrinogen is dissolved in your blood. You wouldn't be able to see it, but when thrombin comes along, it activates fibrinogen and turns it into fibrin. Fibrin now are these threads that you can see, these protein strands, and you can actually see the network that they form, particularly if you look over here at the electron microscope image. And now it's going to form this net that's going to catch everything. It'll catch your red blood cells. It's going to catch your white blood cells and your platelets and all of those things, and it's going to form this clot, right? Your common pathway is definitely where we actually see the activity of this fibrin. So I don't want you to know the details. You don't have to name these structures that are here, but I do want you to know that the extrinsic pathway starts with tissue damage, ends up activating factor 10 with the help of calcium ions. The intrinsic pathway starts with platelet factors. With the help of calcium ions, it's going to activate factor 10 as well. Once factor 10 is activated, that's going to activate thrombin, which is going to activate fibrinogen and make it fibrin, and we're going to end up with these protein fibers that will cause this network or this blood clot to form. This is a positive feedback mechanism. So once we start on this clotting factor, this formation, this area of platelets collecting causes them to release more platelet factor, which causes this intrinsic factor to continue, which causes more fibrin to form, which causes more platelets to get caught, which causes more platelet factor to be released, which causes this cycle to just continually going. So this is one of the few positive feedback mechanisms that you have. Remember, in positive feedback mechanisms, as one thing increases, the next thing increases. So as platelet factor is released, it's going to cause more fibrin, which will cause more platelet factor, which will cause more fibrin, and it just goes round and round in circles. We need to control this blood clotting, and we use anticoagulants. So somebody who's having problems with blood clots, what heparin does is heparin actually affects thrombin formation and doesn't allow as much thrombin formation to occur. Without thrombin, I can't convert fibrinogen into fibrin, and so I'm going to slow down clotting times. Aspirin, the reason why people with heart conditions take a baby aspirin or a small dose aspirin a day is to assist in reducing clotting, and that's because aspirin actually will make these platelets less sticky, and so we're less likely to have platelet aggregations, and without these platelet aggregations, not so much platelet factor, we're not going to have as much factor 10, and so forth and so on. Fibrolytic agents are the ones that are going to actually break down the fibrin. So over time, when I'm ready for my blood clot to be broken down, we'll have fibrolytic agents. We also sometimes will give drugs that are fibrolytic agents, and they will specifically break down blood clots if you have one someplace that you shouldn't. Calcium and vitamin K are both important for blood clotting. This could be a test question. Calcium ions, you can see, are critical in both the extrinsic and intrinsic pathway. Without them, I can't activate factor 10, which means I won't ever get thrombin happening, and which means I won't convert fibrinogen into fibrin. Vitamin K is a critical component for the liver to be able to make clotting factors. Without vitamin K, we can't make clotting factors. Vitamin K is produced by bacteria in our intestines, and so our liver can't produce it. We don't get very much of it in our diet, but we have a lot of bacteria that will produce vitamin K that we can then use. Often newborns are given an injection of vitamin K to make sure that those clotting factors are being formed, because they don't yet have that bacterial flora in their gut. And so if there would be an injury, they would have a very slow clotting time and could have problems with bleeding. So we give them that injection to help out with that. Clot retraction, this is amazing. Within the clot, there are actually some myosin and actin that will pull the clot up towards the edges of the vessel that have been damaged together, and then fibrinolysis is when we actually are breaking down the clot at the end of this. All right, if you have any questions, please be sure that you send me an email or talk to me as you are studying for the exam. All right, thanks a lot.